Listen-only mode.
Welcome everybody to the webinar on our inaugural Smilefast Symposium. I'm actually very excited about this. Robin and I have spent a lot of time putting together a program which we feel is actually world class, and probably more importantly, the topics that are going to be discussed is what the future of dentistry is all about. And I'm looking forward to showing you little bits and pieces and presenting a little bit about the symposium to whet your appetite for what will be a fantastic 3-day meeting, which I hope that you can attend. So with no further ado, because I know it's very cold here in Melbourne, and let's talk about it. So our first Smilefast Symposium is going to be in September 2017, so this September, from the Thursday, September the 21st to Saturday, September the 23rd at Twin Waters Resort on the Sunshine Coast. Rob and I have visited the resort, which is absolutely fantastic, perfect if you have children, lots of activities to do, great accommodation. Really, it's a spectacular resort. It's probably 10 minutes from Maroochydore Airport, so it's easy to get to. And the way we've organised this program is on each day we have lectures from 8:30 to 1 o'clock. We obviously have morning tea and lunch included in there, as well as social functions in the evening, but it also gives you free time in the afternoon for rest, activities, fun, sunbaking, etc. And we have both a doctor program and a great staff program as well. So for those of you who wish to bring your staff along, I can guarantee they'll get a lot of benefit out of it, and more importantly, it will be a wonderful team building exercise for yourself and your practice as well. So the dates are Thursday, September the 21st to Saturday, September the 23rd at the Twin Waters Resort on the Sunshine Coast. So as I've just mentioned, it's 3 half days of what I'm going to call lecture material from 8:30 a.m. to 1 p.m. On the Thursday, the first day of the program, we're going to have a joint session for both the doctors and staff. And on the Friday and Saturday, we're going to have different sessions for the doctors and different sessions for the staff. And we've got great social events where we've got a cocktail party on the Thursday night and a buffet dinner on the Friday night. And we finish up about 1 o'clock on the Saturday. What's really exciting is we have a guest lecturer, Dr. Alan Rodriguez from Brazil, who has developed a system called the MTB Philosophy, using a self-ligation clear bracket system. And he has a whole technique, and he's presenting for 4 hours on the Friday. Robin and I spent 4 days with him in Brazil a couple of months ago, and I have to say the cases and the results, what he does in less than 12 months for every type of orthodontic case is just outstanding. And it's a program not to be missed, as this is where the future of Smilefast will be going next year, where we not only can treat adults with aesthetic orthodontic outcomes, but we can actually treat all patients, including children, with not only aesthetic orthodontic outcomes, but excellent functional occlusions as well within a 12-month period, using a clear self-ligation bracket. And our aim is to keep the cost at the same as what we're doing now, which is pretty well unheard of, because normally conventional self-ligation brackets would add an extra $800 to the cost. And this guy, Alan Rodriguez, is a brilliant orthodontist, and it's a 4-hour presentation that I can honestly say should not be missed at all. And to give you a little bit of background about Alan Rodriguez, he was part of the Roth-Williams group. And for those of you who don't understand, Ron Roth developed the Roth appliance, but more importantly, Ron, who was one of my instructors back at Penn, was really into functional occlusions, TMJ. So Alan Rodriguez' background is not just aesthetics, but also obtaining good functional occlusions, which is why in the past we've limited Smilefast to adults, but with his technique and his approach, we can now open up the gamut of orthodontics to not only adults but also to children using his MTB system, which is designed for not only aesthetics but also for an ideal functional occlusion. And he lives in Brazil in a place called SANTOS, and this is a beautiful city, as Robert and I found out a couple of months ago. It's just wonderful with a beautiful beach. It's about 2 hours drive from Sao Paulo. And this is actually his view from his apartment and where he works from. It's just a spectacular view. And he's just one of the nicest guys that you'll ever meet. And he's so happy and just wants to help and educate general dentists. And he does this worldwide. And he's written many books. And one of his books has been about self-ligation brackets. And he's developed a self-ligation clear bracket which is called the Crystal 3D system. And we've been trialing this for the last 12 months in our practice. And the results are fantastic. He's also developed a white wire, which is quite unique as it has very, very low forces. So a 1925 wire in his system is the equivalent force system. It's about 1/4 of the force of an 014 nitinol wire. And the results are just spectacular. And more importantly, this wire does not degrade in any way. So one of the problems that we've all found with previous white wires was the fact that they discolor and the Teflon coating chips. This wire has no Teflon coating at all and does not chip, and you use the same wire basically for the entire treatment. So it's actually quite revolutionary. So he will talk about his principles of his MTB philosophy, which is maxillary transverse bioadaptation. And it's actually a very simple philosophy once you understand it. And this is what the Crystal slimline bracket looks like. It's a very aesthetic bracket. Doesn't discolor because there's no need for any O-rings or elastics as in conventional orthodontics. And with the new clear wire, it's an exceptionally aesthetic system. So to give you an idea, using his self-ligation bracket system with his technique, and obviously I'm not going to steal his thunder particularly, but his technique is based on a lot of scientific evidence. In fact, more evidence than I've ever seen with any other system. But just to give you an idea, in 6 months, with the one wire, before and after. So here's a patient who's got severe crowding, a patient that would never, ever have been suggested for Smilefast in the past. And here we are with severe crowding. And with his technique, he's put the brackets on and he's using a clear wire. So this is the day the braces are placed. And 11 months in treatment, you can see the improvement in the appearance of the teeth and improvement in the occlusion. And this is with one upper and lower 1425 nitile wire. And the patient will only use what we call transverse elastics at night time. So all of these patients will only use transverse elastics at night to broaden the upper arch. So to give you an idea, 14 months in treatment. Now this was a very difficult case. This would be a case that conventional orthodontics would take probably 2.5 years to do, and you would never get the result that we've got in 14 months of treatment. So it's not only aesthetically a great result, but also a functionally excellent result as well. We've got an ideal class 1 mutually protected occlusion, and this is where his bias comes, that he not only looks at the aesthetics, but he's developed a system which will then also provide a good functional occlusal result as well. And this will all be brought to you in his 4-hour presentation, which is the doctor session on the Friday. But if you want some staff to attend that session, please feel free to. So to give you an idea, his philosophy, when I said he's based it on a scientific approach, he's used cone beam X-rays and tomograms to ensure that all of his movements of the teeth are all in the basal bone, something that most orthodontists have never done in the past. So all of it has been scientifically proven that by doing this expansion, by doing this alignment, the teeth are in the right position in the alveolar bone, which once again provides even greater stability for the end result. So here we are 11 months in treatment with a very nice arch form and improved anterior aesthetics as well. And he has his own type of bonded retainers, which he'll also go through with you, which is a simple approach that can actually be done chairside for any patient. So once again, this can save in laboratory fees for you from the point of view of retainers. So the initial and 14 months of treatment. This is one of the more difficult cases. And you can see the difference in the aesthetic result from the smile. Quite significant. And Alan Rodriguez believes that every case could be treated non-extraction with his approach. Something that I must admit I still haven't come totally to terms with, but we are trialling this in our practice, and the results that we've seen have been very impressive, to say the least. So another case that when you look at this patient, they would have been suggested to have orthognathic surgery from the point of view of the anterior open bite and the long lower facial height. So here we are with severe crowding, quite protrusive lower incisors, and we've got a class 3 buccal relationship on the left-hand side and a minor class 3 buccal relationship on the right-hand side. And once again, this would have been a patient that would not have been eligible for traditional Smilefast treatment. And here we are. His treatment plan is to bond the upper and lower, and he's showing how he positions the brackets. And he's putting what we call bite turbos, as you know what bite turbos are, but he places them normally on the upper first molars or the upper second molars. And there are reasons for that in his philosophy, and it seems to work exceptionally well. And in his philosophy, most patients will wear transverse elastics purely at night time. So the buttons are placed usually on the 4s and the 6s of the palatal surface to aid in transverse elastic wear. So this patient was treated in 12 months using his MTB philosophy, using his crystal slimline 3D brackets, the self-ligation brackets, using his very unique arch wires, and using his MTB philosophy of building up the posterior molars with bite turbos and utilizing transverse elastics. And those transverse elastics, remember, are only worn at night time. And you can see the exceptional result in 12 months. Results that Rob and I just blew our mind when we saw it in his practice. And we saw case after case after case. So case treated in 12 months using the MTB philosophy, and once again, obviously bonded retainers. Before and after. So the results are spectacular. I can assure you his 4-hour presentation will be worth coming along to the symposium just by itself. And like I said, what he's been doing in all of his cases is using cone beam technology to ensure that his technique will keep the roots in the basal bone. And case after case, he shows the roots perfectly positioned in the basal bone. So all perfectly positioned. They're not outside the basal bone. They're in a very good retentive position, as well as an excellent aesthetic position as well. And look at the difference in the aesthetics of this patient after 12 months of treatment. So, Alan Rodriguez will be presenting on the Friday for 4 hours to the doctor's session. And as I said, if you want some of your staff to attend, feel free to. We've also got other lecturers. Most of you have heard of Tony Serace from Momentum. And in our first day on the Thursday, which is a joint session for both the doctors and staff, Tony will be presenting for 2 hours on helping your patients say yes. How do we get our patients to understand the importance of our dental treatments and want to have them? And learn how to ask the right questions to find out what your patient really wants and discover your patient emotional hot buttons. Things which I've talked about briefly in our course previously, but now we've got one of the experts in communication and an expert in practice management. And Tony is a wonderful lecturer, as most of you would have heard of it. So we're very fortunate to have Tony for the 2-hour presentation to the joint session. We've talked about Alan Rodriguez just previously, and he's our lecturer and obviously keynote speaker. And the title of his lecture is The Orthodontic Clinical Principles for Faster Invisible Treatment Based on Clinical Evidence. And as I've said, there are very few orthodontists in the world who base their treatment on clinical evidence. It's all anecdotal. And so basically what he's saying is we've got an aesthetic, cost-effective self-ligation system, and we're using a simple, non-invasive, physiological dentoalveolar movement with these aesthetic, clear self-ligation brackets. And now he's gone further into his philosophy, and basically 90% of his patients are using purely one thermoactive arch wire, which has very, very, very light forces. And the key to this is we can now treat, using his philosophy, not only our adult patients aesthetically, but our adult patients aesthetically and functionally, as well as our adolescent patients aesthetically and functionally. After speaking to many people who I have a lot of respect for in the dental industry, I really feel that another area that people need to address as in general dentistry is the area of oral medicine, TMJ therapy, sleep apnea, which I think is one of the big areas in the future. And as such, we've invited Dr. Michael Stubbs along, who is a superb specialist in the field of oral medicine and oral pathology. He's been doing oral medicine since 2002, and he's going to be talking to both the doctors and the staff in separate programs. So for the doctors, he's going to talk about the common and not so common conditions from an oral medicine perspective, but with an emphasis on TMJ and sleep apnea. And a similar type of lecture to the staff, managing the patient's oral health from an oral medicine perspective. And Michael is a wonderful lecturer who will provide you with a lot of insight, and I think you will leave that lecture knowing that you need to address this as part of your dental practice if you want to be at the cutting edge in the future. So I'm looking forward to hearing Michael. And then we've got Carl Burrows, who's going to be talking about it's all about your website. So everybody would know Carl. He runs IDM, the management group, and Carl has got an exceptional knowledge in the area of marketing and dentistry. And one of the interesting things with Carl is a marketing person, but Carl owns his own dental practice. And so everything he does, he trials in his own dental practice. And I think that's a really unique part of marketing, that he's not just talking the talk, but he walks the walk as well. And so Carl's going to be talking about in 2019, which is not far away, 60% of all dental appointments will be made online. We see that with Uber, we see that with Airbnb, we see that now with Trivago, with the hotel.com, etc., etc. And even though we believe that dentistry is of personal nature, the same issues will apply with online marketing. So we've got to know how to market online, how to market effectively online, and more importantly, how to get the right patients into your practice. Because I know that's been one of my issues with online marketing in the past, of trying to drive the correct patient into the practice. So Carl's going to explain not only the online strategies that are working today, but also what we should be embracing to stay relevant for tomorrow. We've also invited Kathy Metaxas, another professional motivator, and she's the Director of Platinum Professional Development. And I've heard Kathy speak many times, and she does a sensational presentation on personality profiles and on the different types of generational differences. And so we've invited Kathy to lecture to the staff, learning how to communicate with the different generations and personality types, so we can eliminate many of the typical confrontations and misunderstandings that do occur in the workplace. And it's interesting, since I heard Kathy speak about this a few years ago, I actually understood much more about the generations, the different personalities of my female staff, etc., etc. And it's actually helped to make my life less stressful and also provide a better service beyond the patient's expectation once you understand what are their emotional factors or the emotional hotspots for the different types of generations. And Kathy delivers a fantastic presentation in a very fast, fun style. And she's going to tell us how to apply these fabulous strategies every day into your life, not just into your practice. And that'll be a really interesting 2-hour program for your staff. Then we've also got Tammy Seville on, who runs a company called 1122. And what we've done with Tammy, and I've mentioned Tammy to you many times in our lecture program, she is the expert on photography. She is the expert on PVS impressions. And we've organised for Tammy to provide 2 lots of limited attendance sessions for the staff. And so the staff can be trained on photography, they can be trained on clinical record taking and impression techniques. But we have to limit each one to each session on the Friday and the Saturday to 12 staff members. So it's first come, first serve. There's no extra cost to the staff. This is all included in their registration fee. And once again, from a medico-legal point of view, from a communication point of view, the quality of the records is absolutely essential. And she will go through and show you hands-on how to take, or show your staff hands-on how to take the photographs, how to do the PVS impressions, etc. So you've got the choice whether you want to do it on the Friday or the Saturday. And in fact, if any of the doctors want to do it themselves, they're most welcome to as well. So we're going to go through, as you know, photography is really important, and Tammy's going to go through the photography, the type of photos that we require for Smilefast, but the type of photos that are really required for any type of case presentation and documentation. And the occlusal photographs, how to take good occlusal photographs, what to look for, etc., etc. She's going to show you the correct instruments that you need to use for the photography, the correct cameras, but she uses, from what I understand now, just purely an iPhone with a macro lens. So it's a very, very simple technique that she will teach you. The type of mirrors, which are the best mirrors to obtain the best photographs. And she also works with David Penn at Penn College, and she will also be teaching you the best type of impression technique, which would be, at this stage, the PVS impressions using a 2-stage putty and light body technique. That's for those of you who are not doing digital impressions, And having said that, we have a trade display where we will also have Dental Axes there with their Trios scanner and other companies as well, on payment plans, on orthodontic materials. So there's probably going to be 6 or 7 members of the trade where you'll have all the time in the world to socialise with them in the evenings, to sit down and talk to them about the cutting edge technology, which I think you're going to need to be involved in to keep your practices at the forefront. But there's no doubt that the 2-stage PVS technique is the most accurate technique, and Tammy will demonstrate that to you and show you how to do this in the easiest and most cost-effective manner. So Tammy also does in-office training as well. So if some of your staff can't make it, well, she can actually come into your practice and do it as well. So maybe it's something where you bring one or two staff members, see what you think, and then if you're really impressed, which I know you will be, bring Tammy into your practice for an in-office training session on both photography and PVS impressions. The nice thing, though, about the symposium, it's all covered. And then you've got Robin, who I think everybody will know, and she's going to talk about Smilefast and the cookbook approach to patient integration, what every auxiliary needs to know. And for those of you who know Robin, she's my right hand and my left hand, but she knows more orthodontics than any orthodontist that I've come across. And she's going to give your staff the tools to make sure we can get Smilefast up and running efficiently in your practice. She's going to discuss the processes that are involved, the role of the auxiliary both clinically and in the admin area, and the techniques to convert existing patients to Smilefast, as well as to help drive external patients into their practice as well. And we're going to go through the relevant forms, which will aid the education of the patient and also protect you as the practitioner. And we're going to give the staff the understanding of when these forms are delivered. So Robin's basically going to be talking to the auxiliary program. As an addition to that, we finish the lectures at 1 o'clock, and lunch is included, that everybody can be together for lunch. And Rob and I will be available for another hour or so after lunch if anybody wants to discuss cases with us or anything else about Smilefast. We're also going to be discussing at some stage during the symposium what we're going to be doing next year, which is very, very exciting, where we're going to sort of even change the whole philosophy of Smilefast and provide you with not only cosmetic orthodontic training, but basic training in most areas of orthodontics. And we're going to discuss extraction cases, non-extraction cases, management of class 2s, management of class 3s, and we can do so now because of the integration of this MTB philosophy that Alan Rodriguez will be talking to you about. Because now I feel comfortable we have an approach that we can treat more patients, just about all patients, in fact, both aesthetically and functionally. On the first day, which is the joint doctor and staff session, I've already mentioned that Tony Serace is going to will be lecturing, but also I'm going to give a 2-hour presentation on interdisciplinary dentofacial therapy, and I'm going to talk about those cases which require more involvement with both the perio, endo, orthodontic surgery, etc., setting up cases for implants, and give you a lot of tricks that you can utilize for these more difficult cases. So I think everybody knows who I am, but basically what we're going to be talking about is how do we resolve these difficult cases with periodontal issues so we can improve their alignment and their inclusion and provide the necessary space requirements for restorative dentistry. And we're going to demonstrate the diagnosis and treatment orthodontically of perio issues, including asymmetric gingival margins, correction of periodontal issues, including posterior bite collapse, indications and contraindications for forced extrusion. In addition, I'm going to discuss orthodontic bone regeneration for implants, both in the vertical and sagittal dimension, and finalising occlusions for different restorative requirements. In other words, how do we set up the occlusion if you're going to put a Maryland bridge in could be totally different to how we set up an occlusion if we're going to be placing implants in the future. So I'm going to discuss tricks and tips of how to open and close orthodontic spaces, and we're going to have a brief discussion on how do we look at orthodontic treatment for surgical cases as well. So that's a 2-hour presentation to both the doctors and the staff, and hopefully you're going to enjoy that very much. To give you an idea of some of the cases that you may see from my IDT lecture, this girl comes in with a class 3 and she's missing an upper right premolar tooth, and she's got an anterior crossbite, and as I've said to you many times before, most of these patients would require orthodontic surgery. This patient went to 5 orthodontists, all who suggested orthodontic surgery. We use different technology to do our planning. We put the braces on, and our aim here was to open the space for her missing 1-5. So here we are with our braces on, and here we are 12 months into treatment. The anterior crossbite's corrected. The space is now present for the implant in the 1-5, and this was done, that was about 12 months into treatment, and we're just finishing this patient off now, but we're going to go through all the tips, all the tricks of how to do all that. This girl comes in with a severe dolichofacial pattern, anterior open bite, very narrow maxilla, as you can see. And so we're going to look at the different types of diagnosis and treatment planning for this type of patient. But this patient did require some orthodontic surgery in conjunction with a palatal expansion appliance that you can see. So we've expanded a palate, and we've done that with what we call the SAME, which is surgically assisted maxillary expansion. We go ahead and put braces on. We treated her non-extraction. Then we decided we better extract a lower incisor because she was still as a class 3, rather than doing another definitive orthodontic surgery because she didn't want to go through a second one. You can see the improvement in the upper arch form. And here we are after about 18 months of treatment. But I can tell you now, if we were using the Alan Rodriguez MTB philosophy approach, we probably would have treated this patient far, far quicker by using a better type of self-ligation bracket. So here we are with not a bad result from a patient who started off with an anterior open bite and started off with severe narrow maxillary arch. So just to remind you, it's on September the 21st to Saturday, September the 23rd. The lectures are from 8:30 a.m. to 1 p.m. We have half an hour for morning tea. It's at the Novotel Twin Waters Resort. The cost is $1,500 for the doctor plus GST. The hygienist or therapist or auxiliary staff member is $700 plus GST. And if you want your spouse to come, they are most welcome to come to any of the social events, and that's $250 just for the social events. Now, if you want your hygienist or auxiliary staff to come to any of the doctor's sessions, or you want to attend any of the staff sessions, you are most welcome to. The only thing we're going to ask you is if you want to attend Tammy Seville's limited attendance clinic, you must let us know, because that will be obviously limited in attendance, so that every participant gets the maximum amount of benefit from the program. So to enroll, you go into the Smilefast website, onto courses, and you just select who you want to enroll, okay? And if you've got any dietary requirements, etc., let us know. Now, there is a voucher, and on the bottom of your screen, you'll see the voucher, and if you would like to book now, well, I'll give you the voucher code, and you can obtain a 10% discount for the voucher. So it's $1,500 for the doctor, $700 for a staff member, whether it be a hygienist or a auxiliary, and it's $250 for the spouse. And I've got to say, it's the most wonderful resort that I haven't seen a result like that for many, many years. So your voucher code to obtain your 10% discount is TWSYMP. TWSYMP. And Robin made that voucher code up, so I really don't know what it means, but it did mean Twin Waters. That's right. So Twin Waters Symposium. So TWSYMP. So put that into the voucher code area and you get 10% off. So as another benefit for anybody who registers for the symposium, we're going to give you 50% off a future Smilefast course. And next year, we're going to be doing a course probably of 8 courses going through the gamut of orthodontics. And so you can get 50% off one of those courses. You get 2 cases at 25% discount. And we're also going to do a raffle that whoever wins a raffle, Rob and I will come into their practice for 1 full day of in-office consultation, staff training, and clinical guidance. And that will be all costs will be covered by us, but it's only for in the capital cities. If you're not in the capital city, we would just have to make some adjustment for that. But we will cover the cost up to the capital city and cover our own accommodation and travel costs as well. So the social events, as I've said before, on the Thursday night, we've got a cocktail party. On the Friday night, we've got a buffet dinner. And I think we've got a golf session on the Friday afternoon for anybody who wants to attend. There is an extra fee for the golf session, but it's a fantastic golf course. So I really would, but the facilities are just out of this world. There's kayaking, catamaran, you name it, they've got it. So I think you're going to have a real fantastic time at Twin Waters. So if you want to attend, obviously you need to register with us, and we would love to see you because I think this is going to be the start of a revolution, and you will really be at the forefront in the future for your dental practice. But for accommodation bookings, and there are different types of accommodation, you can get twin rooms, adjoining rooms if you've got family, and they're quite reasonably priced, and the accommodation is really very, very good indeed. So contact Hannah Cockerell at Novotel Twin Waters Resort. Tell them that you're at the Smilefast Symposium, and the telephone number is 07 5450 9591, and you can email them at groups@twinwatersresort.com.au. So that's just a brief overview of what is really exciting for us to put on our first Smilefast Symposium. It's not all about Smilefast. It just happens that Smilefast is putting it on. We've tried to develop a program that is going to be really interesting for your staff, a program that's going to be fascinating for you as the doctors, where you're going to walk out of those 3.5 days going, that was the best program I've been to. And it's going to be, we're going to make it into a really wonderful social time. And we really would urge you to bring yourself, bring your family if you want, bring your staff, because I think it'll be a great team building exercise. And I think it'll be a fantastic, fantastic program for them as well. So I really hope that we can see all of you at Twin Waters for our inaugural Smilefast Symposium and give you a taste of the MTB philosophy as well as all the other great lecturers as well. We really look forward to your feedback, and we are planning to do a symposium every 2 years. It's obviously a lot of work, but we're planning to do that every 2 years. So we really value your feedback as to the type of lectures you would like, the type of facilities, etc., because at the end of the day, we are there to make you happy, to make your practices more successful, to make your working conditions better, and to make your life better. So please contact us if you've got any questions at all. Give us a call on 1300 447 448 or email Robin at smilefast.com.au or myself at jeff@smilefast.com.au. Okay, I'm happy to take any questions. I wanted to keep this short and brief, but I'm hoping that you got a bit of a taste as to what our Smilefast Symposium is all about, and really hope that you can join us for what I think is going to be a fantastic 3 days. So thank you very, very much, and look forward to seeing you there. So we've had a question: is it possible to book the limited attendance sessions? Absolutely, it is. Okay, if you can email Robin, she will organise that, and the doctors can attend any of the sessions as I've said before. Okay. Robin's session is not limited attendance. Anybody can come to Robin's session. Okay, on the final day. The only session that is limited attendance is Tammy Seville's session on photography and PVS impressions. We've limited that to 12 people per session. So you can choose either the Friday or the Saturday. They're bearing in mind, though, for the doctors, the Friday is when Alan Rodriguez will be presenting, and I really would recommend, if you want to do Tammy's session, the Friday you really want to be doing the Alan Rodriguez one, because that's a once in a lifetime, and book the Tammy in for the Saturday morning then. And is it possible to watch a webinar again? Yes, we've actually recorded the webinar, and and Adam tomorrow will be sending it all to you as well. So yes, I should rephrase that. I'm hoping the recording worked, and I'm sure it has. Any other questions at all? Well, I want to thank you for your time. I know it's always hard to watch a webinar, but many, many thanks for listening to me. And we're looking forward to seeing you, John, and anybody else at the symposium. And I can honestly say, I'm going to stake my reputation on it that it'll be a fantastic 3-day event. So thank you very much. Have a great night, and look forward to seeing you guys in September. But please feel free to contact us if you've got any questions at all. Thank you very much. Good night.